Hi, I'm Adam Woodbridge. I'm an orthopaedic surgeon, and today I'm here to speak to you about total knee replacement surgery. Total knee replacement's the most common form of major surgery that we use to treat osteoarthritis of the knee. Osteoarthritis is a condition where your knee joint loses cartilage that covers the bone and ultimately ends up with significant wear to the point where there's bone-on-bone contact in your knee, which then creates significant pain and dysfunction. When our simplest treatments have failed, then the most common recommendation for treatment would be a knee replacement. Now, what is a knee replacement? Well, a knee replacement is where we open up the knee joint and precisely cut small areas of remaining cartilage and bone from the ends of the bones so that the joint can be resurfaced. A lot of people are fearful that the surgery will remove large chunks of bone, but it is actually more of a resurfacing or recapping of the joint, which is often quite reassuring to patients. We tend to maintain the surrounding ligaments of the knee. In the past, the reputation of knee replacements has been affected by some experiences of patients of significant pain. It has been said that up to 20% of patients can have ongoing pain with a knee replacement, and so some of the advances that we've had in the last 5 years have helped us to reduce the chance of this happening. So I utilise either computer navigation or robotic assistance to help me more accurately restore your knee joint. In the past, we've been somewhat obsessed about achieving an overall neutral or straight knee, and what we've come to realise is that trying to restore a more functional alignment where the knee deformity is corrected back to where it was before you developed osteoarthritis may be a better position to be in as compared to forcing your knee to be straight, which then can increase the load on your ligaments. So the main art of the surgery is to achieve good balance in the ligaments and the soft tissues of your knee, and using things like the robotic assistance helps to guarantee that is well restored, and I think that is one of the keys at the moment to improving satisfaction in knee replacements. Many people are concerned about whether a knee replacement will not last long enough, and I think this is partly because of historical information where people have been told that they only last for 10 years or 15 years, and what we have now is much better information from our joint replacement registry, where every knee replacement in this country has been recorded, and if it has been revised, it has been put on this database, and so now we have 20-year data. And what I can tell you is that after 20 years of having had a knee replacement in this country, the revision rate is slightly less than 8%, which for most people, they find that quite reassuring because it's generally better than they would have expected. So now it's still important that we don't do knee replacements on people that are excessively young, and so this does need to come into the decision-making process, but it is something that can be a little bit more reassuring for many patients. We generally are thinking that most patients over the age of 55 that their knee replacement is likely to last them for as long as they need it. Under 55, a discussion needs to be had about trying to maximise the non-operative treatment as long as possible, but in some cases it can need to be done even despite the relative young age.